Welcome to It's Your Case, presented by vetcity.com. I am Olga Travetti, your radiologist on demand for this week. Today's example is a 5-year-old dwarf rabbit with inappetence. On physical exam, there is a swelling on the ventral mandibular area. So when we are presented with a CT of the head of a rabbit and the main symptom is inappetence, most likely we have a dental disease. So we are starting the assessment of the teeth of this rabbit, looking at the incisors. So I'm creating a sagittal plane reconstruction, and I want to make sure that there is a good occlusal surface. So in this case, the tip of the mandibular incisors is in contact with the caudal aspect of the maxillary incisors. So we have a good occlusal surface at the level of the incisors. So now looking at the mouth, we can actually immediately notice that there are quite a few dental hooks, which are quite sharp actually, and they're at the level of the tongue and at the level of the cheeks. So we have buccal and lingual hooks. So most likely we have a problem with overgrowth of the maxillary and maybe mandibular cheek teeth. But in order to know if this is true or not, we need to check with some measurements. So we are going to start from the left side. And as we did previously, we want to draw a line between the rostral aspect of the nasal bone and the occipital protuberance. And we can see that the reserve crowns of the left side extend beyond the line. So there is overgrowth at this level. And then we want to draw a line between the rostral aspect of the palate and the ventral third of the tympanic bulla. And in this case, we're on the left side, we can see that few of the maxillary cheek teeth extend ventral this line. So the occlusal surface at this level is abnormal and it's too ventral. So then we do the same on the right side. So again, we draw a line between the nasal bone and the occipital bone. And we can see that definitely there is overgrowth also on the right side. And then we want to connect the rostral aspect of the bone palate to the ventral third of the bulla. And at this level we can see that the occlusal surface is normal. So now we want to check also the mandibular cheek teeth. Starting with the transverse slice here, we can see that at some point there is the impression of slight irregularity and thinning of the ventral cortex of the mandible. So in order to check this, we want to again perform a sagittal reconstruction. So when we look at the ventral margin of the mandible here, we can see that there is a bulge at the level of in correspondence of the reserve crowns of two mandibular cheek teeth. So at this level, the mandibular bone has thinned due to the mechanical pressure caused by the growth of the reserve crowns. And on the opposite side, on the left side as well, we can see two small bulges, and we can see that the cortex of the mandible has decreased in width. So in this case, we cannot talk about osteolysis. I think this is more atrophy due to mechanical pressure of the growth of the reserve crown. You can see also that this tooth is slightly bent due to the pressure. So now, having a look at the rest of this study, we have also soft tissue series, and checking the soft tissues, we can notice that on the right side here, this is the normal external air canal on the left side with containing gas, but on the right side, the content of the external air canal is soft tissue. So we have some abnormal material within the external air canal, and when we follow the air canal caudolaterally, we can see that the wall of the canal here is enhancing, and this is abnormal. So concluding, in this rabbit, we have mild to moderate overgrowth of the maxillary and mandibulary cheek teeth, and we have thinning, which is probably due to atrophy of the mandibles, of the cortex of the mandibles, associated with the reserve crowns of the mandibulary cheek teeth. And then we have also right external otitis. So the inappetence that was complained by the owner is probably due to discomfort due to the presence of lingual and buccal hooks, or the rabbit is inappetent because he's developing gut dysmotility secondary to dental disease. And finally, the swelling that was palpated by the vet in the ventral mandibular area corresponds to the area where the overgrowth mandibulary cheek reserve crowns have created an area of atrophy and thinning of the mandibular cortex, and so the bulging is just due to this alteration of the bone. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.